Hello and welcome to SENDIASS Rutland. Mental health in schools. Would you like to understand more about mental health support in schools in England? What is emotionally based school avoidance? And where to access help and support for your child with SEND? Overview. This presentation provides background to the current policy and practice landscape as of May 2022 for mental health support in schools in England. It outlines the current legal requirements of schools and the government's commitments to supporting pupils' mental health and well-being, as well as national and local resources that those working with school-aged pupils can use and refer to. Emotionally based school avoidance, EBSA. This refers to school avoidance in children and young people where the reasons for the absences are rooted in negative feelings and/or experiences, such as anxiety, bullying, and bereavement. Schools do not currently have any legal obligations regarding attendance, taking reasonable steps to establish the whereabouts of absent pupils and reporting absences to their local authorities. The Department of Education states the schools should put in place appropriate safeguarding responses for children who go missing from school, particularly on repeat occasions. Local authorities also have a legal duty to establish the whereabouts of pupils missing from school and to make arrangements for them to return to school or engage in other suitable full-time education. The Department for Education states that local authorities must put systems in place for identifying, as far as it is possible, those children of compulsory age in their area who are not school registered or receiving suitable education otherwise than at school. Local authorities should trace those children and ensure that they receive a full-time education. Beyond these legal requirements and best practice advice, there are a range of useful guides, tools, and resources highlighting local responses to practically supporting pupils with EBSA. Oxfordshire County Council have published a best practice guide for schools to use to support their pupils affected by EBSA, which lays out 3 key elements involved in helping pupils return to school: relationships, agency and control, and practical support. West Sussex County Council have published a range of printable resources for schools, pupils and parents on EBSA, including research findings and information on practical advice and steps for schools to follow. Suffolk County Council have published a range of resources and information for schools, pupils and parents. You can find all of these links and resources in the description below. All of these approaches acknowledge the potential range of psychological reasons behind school avoidance and recognise that supporting pupils' mental health and well-being is central to helping pupils to return to education. Background. The mental health of an individual is affected by multiple factors, including physical health, living environment, genetic predisposition, adverse or positive life experiences, levels of social support, societal influences, and personality. This is conveyed in the World Health Organization's definition of mental health as a state of well-being in which an individual realizes their own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. There are multiple social, psychological, and biological factors that determine the level of mental health of a person at any given time. This definition encapsulates the dynamic nature of mental health and the helpfulness of conceptualizing it in terms of a person's ability to respond to and deal with challenges, rather than, for example, feeling happy most of the time or rarely experiencing negative emotions. In contrast to being mentally healthy, mental health problems and diagnosable conditions are defined as distinct from ordinary ups and downs seen in normal mental health, and present more substantial problems with abnormal thoughts, perceptions, emotions, behaviours, and/or relationships with others. In 2021, the NHS estimated that 1 in 6 of all children and over half of all UK children with SEND had a probable mental health disorder. The COVID-19 pandemic is demonstrated to have had a significant impact on the mental health of children and adolescents, but it is important to recognise that the development of mental health needs in these age groups began increasing prior to the pandemic. Between 2017 and 2021, the chance of a young person developing a mental health need rose by 50%, and the Mental Health Foundation has found that children with learning disabilities are 4.5 times more likely to develop mental health difficulties than children without. The COVID-19 pandemic has affected certain groups of children and young people more severely than others. The mental health of children and young people who are economically disadvantaged, female, with pre-existing mental health needs and/or those with SEND has been particularly negatively affected. Whilst the pandemic has had an impact on all children, however, some have reportedly coped with it well, and others have reported improvement in their mental health and well-being, such as children who had been bullied at school. With credit to NHS Digital, this table shows the percentage of children with a probable mental health disorder by SEND status in 2017 and 2021. In 2017, 44% of children with SEND, in comparison to 8% of children without SEND, had a probable mental health disorder. In 2021, 57% of children with SEND, in comparison to 13% of children without SEND, had a probable mental health disorder. Intersections between mental health needs and SEND. There are a number of intersections between mental health needs and SEND, and many of these influence the ways that children and young people are perceived, supported, and protected from harm. Children who experience a mental health need and/or SEND are more likely to experience social stigma, which can be more damaging and socially isolating than the conditions they may be living with. Mental health needs and SEND are also disproportionately spread across society, with children growing up in poverty and belonging to a black or minority ethnic identity being at a higher risk of developing conditions associated with either category. Both mental health needs and SEND greatly benefit from early intervention, which can have decisive influence over whether a condition becomes disabling or manageable for both young people and their families. Early identification and support of an emotional problem can prevent a mental health problem or diagnosable illness from developing in adolescence or adulthood. Legislation, guidance and levers. All schools and school staff in the UK have a legal duty to safeguard the well-being of their pupils, and the Department for Education's Keeping Children Safe in Education states that it is essential that everybody working in a school or college understands their safeguarding responsibilities. These safeguarding responsibilities are defined as protecting children from maltreatment, preventing the impairment of children's mental and physical health or development, ensuring that children grow up in circumstances consistent with the provision of safe and effective care, and taking action to enable all children to have the best outcomes. In addition to these legal requirements, the government sets expectations for schools and lays out best practice for them to follow. Mental health and behaviour in schools states that a school's approach to mental health and behaviour should be a part of a consistent whole-school approach to mental health and well-being, and that schools have an important role to play in supporting the mental health and well-being of their pupils by developing approaches tailored to the particular needs of their pupils. It summarises that schools should promote their pupils' mental health through prevention, creating a safe, calm environment where mental health problems are less likely to develop. Identification, recognising emerging issues as early as possible. Early support, helping pupils to access support at an early opportunity. And access to specialist support, working with external agencies to provide swift access to specialist support and treatment. Transforming Children and Young People Mental Health Provision, a Green Paper. In 2017, Transforming Children and Young People's Mental Health Provision, the Green Paper, the government made a set of commitments to improve children and young people's mental health and well-being. These included senior mental health leads, mental health support teams, mental health in education action group, mental well-being within relationship and sex education, RSE, whole school approach, long-term plan commitments, integrated care systems, and social prescribing. Senior mental health leads. The government committed to incentivising and supporting all schools to identify and train a designated senior lead for mental health and announced £9.5 million for training to begin in September 2021. Senior mental health leads are designated members of school staff who are responsible for promoting and embedding the whole school approaches within their schools. The training equips senior mental health leads in how they can promote good mental health and well-being in their setting, how to quickly identify pupils who need support with their mental health, how to use existing resources more effectively, and how to work efficiently with local children and young people's mental health services, including mental health support teams, where established. The government offers grants of £1,200 to a senior member of school staff to access training which can be applied for online. There are a number of Department for Education approved training courses and providers, including the Tavistock and Portman NHS Foundation Trust, the Anna Freud National Centre for Children and Families, Place to Be. The full list of approved training providers can be found by using the links in the description below. Mental health support teams. The government pledged to fund mental health support teams, MHSTs, to provide additional capacity for early intervention and ongoing help for school pupils with mild to moderate mental health needs. MHSTs also act as a link between schools and local mental health services for children and young people and are able to provide or signpost to existing provision. A key feature of MHSTs is that they work with settings to understand the particular characteristics and needs of their students. MHSTs are not operational in all areas, but by 2023 there should be 399 MHSTs up and running to offer support to almost 3 million pupils. The University of Birmingham has published an early evaluation of the MHST's Trailblazer programme, which can be found in the description below. Information on the Leicestershire Partnership NHS Trust MHST can also be found in the description below. Mental Health in Education Action Group. This comprised of government ministers, charities and youth ambassador Dr. Alex George, who convened to discuss ways to improve mental health and well-being in schools, colleges and universities, and consider the impacts of the pandemic on the mental health and well-being of children, young people and education staff across the country. The group established that education settings must be able to access clear, evidence-based advice and sources of support for the issues they find most difficult to deal with, additional guidance on how digital support can complement their pastoral support and face-to-face provision, clear and coherent advice on how to use catch-up and recovery premium most effectively for pastoral support, and locally available support that they can access for their pupils. Mental health within RSE. The relationships education and relationships and sex education curricula for primary and secondary pupils must feature a focus on mental health and well-being and emphasise its link with physical health and healthy relationships. Teaching for both primary and secondary pupils must include the deliberate cultivation of character traits and positive personal attributes that improve and sustain mental health and well-being, achievement, and interpersonal relations. This includes, for both age ranges, resilience, the ability to continue despite setbacks, and understanding the importance of self-worth. Secondary pupils must be taught about the role of social action and engagement in positive mental health and well-being, and schools should provide them with opportunities to undertake social action, active citizenship, and voluntary service to others locally or more widely. Whole school approach. Public Health England's Promoting Children and Young People's Mental Health and Wellbeing lays out 8 principles that schools and colleges can use to create a whole school approach to mental health and wellbeing, wherein all staff within the school system are equipped and empowered to respond in an appropriate and timely manner to any concerns they have for the mental health and wellbeing of their pupils. The National Institute for Health and Care Excellence, NICS, advocates for the importance of whole school approaches in primary and secondary schools as effective ways to support the mental health and well-being of all pupils within a school system. The Department for Education also identifies whole school approaches as protective factors for children and young people's mental health and recognises collaborative multi-agency working as a central component of the model, where schools are able to swiftly refer their pupils to external agencies where their needs cannot be met within the school system. Public Health England's 8 principles for creating a whole school approach to mental health and well-being. Leadership and management that supports and champions efforts to promote emotional health and well-being. Curriculum teaching and learning to promote resilience and support social and emotional learning. Enabling student voice to influence decisions. Staff development to support their own well-being and that of students. Identifying need and monitoring impact of interventions. Working with parents and carers. Targeted support and appropriate referral. And finally, an ethos and environment that promotes respect and values diversity. These 8 principles set out the foundational components of a whole school approach, but the ways that schools implement them have varied, which has enabled schools to create and embed approaches that reflect the individual needs of their pupils. Different approaches to how whole school approaches have been established in different areas of the country through the 6 Head Start partnerships can be found on NCB's website. Long-term plan commitments. In 2019, the NHS launched the Long-Term Plan, which sets out a 10-year strategy for improving and reforming the NHS in England. This includes commitments of the NHS to improve its understanding of the needs of people with learning disabilities and autism, such as by implementing recommendations on restricting the use of seclusion, long-term segregation and restraint for all patients in inpatient settings, particularly for children and young people. The NHS also pledges for children and young people aged between 0 and 25 to be able to better access NHS-funded mental health services to expand mental health services for children and young people, reduce unnecessary delays, and deliver care in ways that young people, their families and carers say work better for them. Integrated care systems. The Health and Care Bill has confirmed the move to statutory integrated care systems, ICSs, by July 2022. All parts of England will now be served by one of 42 ICSs, which will replace around 106 CCGs. Integrated care systems bring commissioners and providers of NHS and other health services together with local authorities and other local partners to plan and deliver health and care services across their geographical area. The move to integrated care systems is designed to enable the provision of better, more joined up care across mental and physical health, and closer working with social care and other key partners. The Leicester, Leicestershire and Rutland Integrated Care System Board can be found in the description below. The Health and Care Bill now require ICSs to publish forward plans which must detail the steps they will take to address the needs of children and young people aged 0 to 25, which puts meeting the health needs of children at the centre of the ICS responsibilities. Integrated care boards will each have a children and young people lead to champion the needs of children, and integrated care partnerships must also include objectives for children's health in their strategies and engage with children and families. Bespoke ICS guidance for children and young people is due to be published shortly as of May 2022, and this will further set out how ICSs should consider and meet the needs of children and young people across their footprint, and there will be statutory guidance on how ICSs must meet their SEND and safeguarding responsibilities. Social prescribing. The NHS long-term plan states that personalised care will become business as usual across the health and care systems, with social prescribing as a key component. Social prescribing is a way for local agencies to refer people to link workers who take a holistic approach to people's health and well-being and connect them to statutory and community services and groups to provide them with practical and emotional support. Social prescribing is becoming increasingly acknowledged as an alternative approach to supporting an individual's mental health and well-being. It can support children and young people with mild to moderate mental health needs by connecting them with their community, developing their hobbies, interests and skills, improving confidence and self-esteem, and making friends. More information on social prescribing can be found in the links below. Local systems context. This model, taken from Lancashire Safeguarding Board, is a continuum of need depicting a graduated scale of mental health need and what support may look like for young people depending on need. It goes from level 1 through to level 4. Level 1, Universal. This describes a universal offer for children who require no additional support beyond that which is universally available in school. Level 2, Universal Plus. This describes children with emerging needs who can be best supported by those who already work with them, such as school teachers, early year settings and youth workers. These young people are likely to be able to be effectively helped by an adult they already know and trust, but may need some extra support than children who sit at level 1 on the scale. Level 3, Intensive Support. This refers to the help needed for children with considerable or complex multiple needs who are unlikely to reach desired outcomes without the support of coordinated multi-agency support. These children may benefit from the social work assessment to ascertain the child's needs and the level of vulnerability. Level 4, Specialist Support. This describes children whose needs require statutory and/or specialist timely intervention to keep them safe, including through CAMS. Levels 1 to 3 are those that can be realistically met by existing provision, with level 3 necessitating a collaborative partnership approach. It is important to note that for those young people described as being level 2 or higher, level 1 universal services can still be very helpful and essential to supporting their mental health and well-being. Universally available services are accessible for all children and young people and play a central role in preventing need from increasing to a higher level. The availability of these services also helps young people who have had previously needed more intensive levels of support to maintain positive mental health and well-being once they no longer require specialist involvement. Examples of support. Examples of support that can be provided by schools include pastoral support plans, early identification of school anxiety and implementation of support, a range of different ways for pupils to share worries and concerns with adults in the school, effective use of school mentor or buddy system, target group work around developing positive social interactions, member of school leadership team leads on pastoral support, emotionally based school refusal resources, child-centred approaches to mental health and well-being challenges, preserve space where children and young people can safely take time out. Common mental health presentations. The guidance, legislation and provisions described in this document are designed to support the mental health and well-being of children at non-specialist universal levels. Whilst they do not replace or stand in for specialist treatment, those who appear tearful, low in mood or socially withdrawn can be given access to free and confidential digital mental health support such as Kooth. Whole school approaches to mental health and well-being can help all school staff recognise signs of low mood and emerging well-being concerns and use well-being measurement tools with students to support and monitor their well-being over time. Those with emotionally based school absence can be supported by the school outreaching and working with parents to identify and support the reasons behind absences. Schools can put measures in place to help students reintegrate into the environment, such as through designated safe spaces, quiet areas, and protected time to talk with a trusted adult. And children who demonstrate anxiety-based compulsive behaviours in school. Student-centred approaches to support can enable school staff to identify which parts of the school day or week provoke anxiety for the young person and put measures in place to support pupils during these times. Families should be able to access clear, evidence-based advice and sources of support for common mild to moderate mental health needs. Digital support. Young people can text SHOUT to 85258 to contact the SHOUT crisis text line or text YM if you're under 19. Kooth provides anonymous mental well-being support to children and young people online. Mapping of locally available support. Where external support is required, it is almost always local. Families need to be able to know what support is available to them locally and how they can access it. You can find out which mental health services are available locally by looking at Rutland Local Offer or the Rutland County Council websites. Urgent NHS mental health helplines can be called for 24-hour advice and support to speak to a mental health professional and for an assessment to help decide the best course of care. NHS local mental health helplines to you can be found on the NHS website. 111 can be called for advice or to arrange an urgent GP appointment. This can be used as an alternative when there are no same-day appointments available at a young person's GP practice. 999 must be called or an A&E visited when someone's life is at risk, such as when they have harmed themselves or when you or a young person feels they cannot keep themselves or another person safe. Free listening services. Call 116-123 to talk to Samaritans or email joe@samaritans.org for a reply within 24 hours. SENDIASS can offer support and advice. Email us on info@sendiassrutland.org.uk. Call us on 07977 015 674. Facebook us at SENDIASS Rutland or contact us on Twitter at SENDIASSR.